Software in the H1 laser is first broken down by the region of the body we're treating. Under head, we have settings for head, jaw, ear, and sinus. In the upper extremity, settings for treating the shoulder, arm, elbow, forearm, wrist, and hand. In the lower extremity, settings for hip, thigh, knee, leg, ankle, and foot. And in the spine, settings for treating the cervical, thoracic, lumbar, and sacral spine. Let's choose cervical. Your next option is acute or chronic. When delivering laser therapy treatments, acute conditions, fresh injuries, tend to respond better to a little bit lower dosage of laser therapy, whereas chronic conditions respond better to a higher dose of laser therapy. Selecting acute or chronic will adjust the treatment time. The chronic setting will deliver a slightly longer treatment. Next, we are selecting the size of the body part that we're treating. This will adjust the power output or the brightness of the laser light. Most of the patients that come into your office we will use the average setting. For a large patient or a large body part, that will increase the power, make the light a little bit brighter. Choosing a small body part or a small patient size will decrease the power, will make the light a little bit less bright. And selecting the child setting would cut the power in half. The next option is light and dark skin. If we run very high power continuous wave on a dark-skinned patient, it will be uncomfortably warm, and it's really not that therapeutic. So when we select dark, it removes the continuous wave and instead uses a pulse frequency of 2 Hertz. Next, we are selecting the patient's pain level. This selection will also adjust the power output of the protocol. Higher pain level, higher power. So we select the pain level. Next, we are at the main screen. In this case, with the selections that I've made, the treatment time is 6 minutes, during which the laser will deliver 3,030 joules of energy. There are selections for time and power boost. Those are for advanced users. Those are advanced features. I recommend that you use the laser for a few months and get accustomed to using the protocols before you start to adjust the time and the power. By pressing the Edit button, that allows you to select the wavelengths, adjust the phase time, adjust the output mode, the pulse frequency, adjust the power, etc. Then when we're ready to start the treatment, now the laser is in standby mode and we're ready to deliver the treatment.